My name is Sonia Martin. I am the co-founder and CEO of Sunny Street. Sunny Street is a mobile doctor and nurse-led outreach service, and we provide healthcare to people who are experiencing homelessness, complex vulnerabilities and poverty across Queensland. I've been a registered nurse happily for 30 years now. I have worked in the hospital system. Traditionally, I've worked though in aged care. I absolutely loved aged care work and working in the community. I've worked both in private and public sector, and in the public sector, I worked as a nurse unit manager based in Queensland, and also a nurse educator, which I really love the opportunity to help teach other people. Sunny Street provides healthcare to people who aren't actually accessing healthcare in the mainstream health services. In 2017, I met Dr. Nova Evans in the Public Health Service, and we really noticed a lot of people coming through emergency departments who were accessing emergency departments for things such as mental health issues, for somewhere to sleep at night, for drug use issues and concerns, people with suicidal thoughts, and I guess just those really complex issues. And we found people consistently representing. Obviously, emergency departments aren't the best place and don't provide the most appropriate care for people seeking this kind of help. So Dr. Nova Evans and I thought we really wanted to make an impact and change the way that people accessed healthcare and appropriate healthcare in Australia. The impacts that we've seen from the Sunny Street service reaching out to people on the streets who are experiencing homelessness have been absolutely profound. Initially, when we started Sunny Street, we thought perhaps healthcare might not be on the top of their list, but we were very wrong. We saw the numbers climb very quickly when word on the street got out that there was a service that was very human-made and was conversation-based and just wanted to connect with people and lean in. In the last 3 years, we've had over 30,000 conversations and consultations with people living in poverty in Australia. Typically, we see 35 to 55-year-old men because unfortunately they're the last to be housed, but our second largest group is 8 to 25-year-old girls. The advice I'd give nurses who wanted to really step out into the world and create either a better model of care or a better product or a better way of determining healthcare, positive impact for people in Australia, is firstly, I'd say how exciting. Innovation is an exciting space in nursing. I would say find a problem that needs to be fixed. For me, it was health inequity for people who have a voice but can't raise it themselves. Find your why and find your purpose, and that's where you get your passion. It's really important to consistently believe in your idea, but to do that, you also need a tribe of people around you. I would say also sit in not only a healthcare space, but an entrepreneurial innovation space, because it's incredibly supportive as well. More than anything, make sure that the person, the community, the patient is the focus, is right at the centre of what you're doing. For Sunny Street, our community members, our patients are the ones that lead the service and honestly have created it for what it is today. The exciting thing for me around being recognised is that there's an opportunity and a platform then for people to understand the issues around homelessness, around poverty and primary health care, and access issues around primary health care. It's also exciting for me to consider the impact that could be made by government in relation to looking at those areas of healthcare and how much support they need as well, and the fantastic work that groups like Sunny Street do for fellow Australians. And finally, I would say it's really exciting also to be a Trailblazer Finalist, to have that recognition, but really for nurses to be recognised as innovators, for innovative leaders, and that's who every nurse has innovation. They're a leader within their role. And I think it's an opportunity to stand up and say to other people, you can innovate. I do think that the world's a malleable place. And I think that healthcare in Australia would benefit from so many ideas from those innovators. So I'm really thankful to have this platform for multiple reasons. And I'm really proud to be a Nurse Trailblazer Finalist.